Today's session is on regulatory inspections and the post-COVID restart. So if you've got any questions, if you could please use the Q&A tab to ask any of those questions you have, and I've allowed time at the end of this today for us to go through those. So just to let you know what we're going to talk about today. So it's a quick session, just 15 to 20 minute session, and that's including Q&A time. So I'm going to give a quick refresh on the situation where we are with inspections. I'm going to touch upon what might stay in the future with any adapted programs. I'm going to look at regulatory information sharing and how regulators are doing that. And then finally, before any Q&A, look at how can you be ready for the restart. So just first of all then, just a bit about me and my interest in the subject. So I've around 30 years of working in a GMP regulated environment, and that's included 17 years at MHRA. And that's where I headed up the inspectorate and was also involved in the development at that time of risk-based inspections whilst at the agency, and desktop virtual inspections that we were doing in a number of areas, but also worked on regulatory crisis management at that time as well on a number of issues. And I also additionally sat on the PICS Executive Bureau, and that was working globally with international drug regulators and looking at ways to share information, particularly amongst regulators there. So that's where my interest in this topic comes from. So let's have a look then. Let's start with what changed. So I mean, and everybody will be in almost all presentations COVID related will be talking about that year of disruption that we've had. So essentially in March 2020, inspections stopped unless driven by a real critical need. So for example, if there were drug shortages or if an inspection was needed for COVID related treatments or therapies, then those inspections may go ahead. But almost unanimously amongst global regulators, they would be happening on a domestic level, those inspections. In that period of time as well, we've seen a number of regulators give flexibilities. But it's been absolutely key, though, that patient safety is needed to be maintained despite any of those flexibilities being given. So some of those flexibilities have been operational, and it's about what manufacturers and importers can do. And then some have been regulatory, and a good example there would be extensions of GMP certificates, the expiry dates being extended. And in this time as well, regulators have had to pivot to a new model. But actually, interestingly, there's no agreement by regulators on what those new models should be or are actually called. So, I mean, typically, in terms of what they are called, there's the X here being the how and the Y being the what. So regulators have either had hows calling them remote, distant, virtual, desktop, interactive, office-based, and the what being an inspection, an audit, an assessment, an evaluation. And probably the word here that's the biggest bone for contention amongst international regulators is the word inspection, and the meaning often of inspection really lending itself to being on site and inspecting something. But I think the clear thing is, though, is whatever you call them, does a site operate to GMP or not? And is patient safety being maintained by that site? So I think regardless of how you call them or how they're done, regulators are needing to come to a clear decision as to what the outcome of that inspection needs to be. And this is still progressing. So just this month, FDA published their guidance, and their guidance is on remote interactive evaluations. And I think one of the key things coming out of that really is that facilities should be ready and prepared, and that's absolutely key within that document, that facilities should be ready to receive an inspection at any point from now. The other thing is, in this time, has been far greater inter-agency information exchange, and we'll just cover that briefly a little bit later as well. So, with those changes that have happened, what is, as we move back to a normal or the new normal, so what could stay within some of those changes that have happened? So, I certainly wouldn't be expecting a straight return to the inspections of old and things to be happening as they were. It's definitely going to be a period of change and some flexible hybrid approaches coming into use, and some of those may stick and actually become the ways that inspections are done much more in the future. So I suspect there will be still far more remote review and assessment and more limited time on site initially. But I think that may find that agencies get better time often to look at documents in more comfort before they do those assessments, and then balance the time that they spend on site to really see the activities they need to. There's definitely going to be a continued use of technology. I think, you know, we've seen, and as we are today, rather than this being a conference where people are at and using technology to do this type of thing, there will be much less face-to-face time and more screen time for meetings and discussions between industry and regulators. But I think as well, within any assessments and on-site work, there'll be an increased visual access through smart technologies. And we've seen some agencies trialling the use of smart technologies and Google Glass or more Microsoft HoloLens type technologies to try and gain access to facilities. But even just the use of a smartphone gives good access into facilities, as I've had to utilise on a number of occasions in doing things recently. I think the wider impact of this whole situation needs to be considered as well, and I think recognising that going forward many agencies will have inspection backlogs. Now these may be, you know, causing delays to approvals, and the focus when agencies get back to being able to pick up their inspection programs a lot more will be focused around backlog clearance, and there may possibly be less time for advice than that regulators have often informally given to industry. And as a final thought as well on this space, and I think depending on the regulator that serves you, it's worth considering what's the financial model within that regulator. Many have financial models that are based on work deliverables, and i.e. inspections are charged for, and that's what funds those agencies. So whether that's going to impact on their ability to support wider work outside of their core work is also something to consider, I think, going forward. But I think the key thing really around what might stay, I think, is the technology and more flexible inspection approaches going forward. So we talked slightly earlier then around how regulators then will have been sharing information and utilising that a lot more. So if we look at how that's done, there's certainly been a greater use of mutual recognition agreements and the ability with those. And a majority of that really has come from the US to the EU MHRA and how that's been utilised a lot more by the US. But I think here, one of the big unanswered questions really within MHRAs, and this is internationally then, is does recognition still stand where the GMP inspection that's been done is a virtual one? So if you've been inspected virtually, other markets you supply, how will that stand up with the MHRA, that GMP certificate that you've been issued? And that question is also relevant, I think, as we look at the PICS Inspection Reliance Initiative, where inspection decisions are also based on outcomes of partner countries. Now that programme was then established to help better utilisation of inspection resources on a global level and to reduce duplicate same scope inspections. So to give an example in that untested area, so would FDA be happy to accept EU GMP certificates if the assessment was conducted in a remote manner? Now, I think that's the next thing we're going to see coming forward, depending on how long we stay in this situation and how quickly inspections get back to a hybrid approach. So at least there is an element of on-site activity, so facilities are seen and taking that forward. So really coming to the key thing today and thinking about, to try and get you thinking a bit about this, is really around the restart and are you ready? Now, I'm, you know, in the time we've got today of really kind of 15 minutes or so maximum and some Q&A, I'm not going to be giving you the answers, but what I'd like to do is at least give you some thoughts of where you could go away, what you could think about for information, where you could find that information. So I think the first thing for me, my advice would be to ensure you're familiar with the processes that are out there. So many regulators have published their information and they're on their websites. We spoke earlier about the US guidance that's just come out. Some of the EU authorities have put out information on how they're taking their programs forward. TGA have certainly put out good information, and as of MHRA. There's a large number of industry guidance documents out there on best practice to help you prepare your site for any type of assessment. And I think in that hybrid type one, where there will still be elements of what would have been a desktop inspection that's been occurring for now, they've got all, I mean, huge numbers of best practice in minute detail of how you can get your sites in the best possible position to receive that audit. And I think even if you look at the recent FDA guidance, it's talking about the ability for Wi-Fi connectivity throughout the facility, even in areas where it's really hard to reach, and how a company's going to actually make that accessible to FDA if they need to do any remote aspects of those assessments. So then I think if you are inspected early within any of this kind of back to normality, then it's much more likely for you that you're either producing new products, you're either producing products that are subject to drug shortage, or you've a compliance history that means that an on-site assessment is really needed for a regulator to see you and see how progress has been made at your facility. But I think when any inspection is conducted, for me, I think the key thing is going to be the content, and considering two things here. I think the content, that any agency is going to have more time with your documents in any type of hybrid approach. So if you're supplying documents in advance compared to those being reviewed on site, there's going to be far more time for them to review things and more scrutiny. And I think you need to be rigorous in what you're ensuring you've supplied to them and how that looks. I've seen examples where some of the documentation that's been supplied to me for doing assessments in a virtual capacity recently, some of it's not been particularly well scrutinised and checked, and actually there's a number of errors that come through that you're just going to be gifting regulators things if you send documents without that thorough check. But then I think the key question that comes is, particularly when regulators land at your door and are on site, and they ask you what has happened at your facility during COVID. And I think the big point here is, how are you going to demonstrate control, and how are you going to show what you've done in the best light? So how are you going to be able to show the quality oversight you've had of that facility, particularly considering if you've had social distancing measures, staff home working, how have you maintained good levels of quality oversight and quality across the facility during this period of time? The changes that you have made, what have you done around change control? Have you had one change control to put those COVID measures in place, or have you had lots? And have you looked at the impact of sequential change and how that's affected any of your facility and any patient safety issues as a consequence of that? Deviations are absolutely, as with any inspection, are a big focus, but I think there will be an increased focus on the deviations you've had raised during this period. But I think you doing some kind of analysis, have you had more, have you had less? Is that because they've been well reported, underreported? Are you keeping control of them? Are you seeing them through? So I think all of those activities really need a good look for you to be prepared for any inspection that's coming. And we talked earlier about regulatory flexibilities. So if your regulator has afforded you any flexibilities, have you used them, and are you able to explain what you've done? And I think finally here, it's about you being prepared for any data integrity issues, and how have you managed to maintain data integrity across all of your processes whilst during this time, where there's been increased pressures on staff, and as we talked about, home working and social distancing as well. So that's trying to give you some tips. But if you need support in being ready, or if you're in a position where you weren't ready and now you're sitting on a huge pile of regulatory findings, Parexel is here to help you. So as an organisation and the team that I'm in, we've been doing on-site, remote and hybrid audits during this period of time. And that's aligned with FDA's six system approach, but also EU and PICS GMPs. And it's absolutely key, I think, that you get things right, because we spoke earlier about regulatory backlogs. And those will really give limited quick second chances. I think if you don't get it right with an agency the first time, you're going to start to fall to the back of a pile of when they're going to be interested to see you again or have a discussion around your remediations. But if you do need to remediate, I think you need to remediate fast and you need to remediate and communicate right. And again, that's an area that if you need support, please do get in touch and we can support you there. And all of this that we're doing through providing a large network of GMP experts, and that includes ex-regulators from US FDA, European authorities, and also China and MPA. So really, that's kind of just taken us 16 minutes. So if you do need to get in touch, my details are here. So just try and have a quick look at the questions if we have any. So. Okay, so we've got one question that's asking about, are there any types of assessment, are there any types of sites where remote assessment cannot be done? So, yes, that's an interesting one, actually. So I've seen from one regulatory discussion where there was a big discussion about sterile manufacturing, and clearly that being much more of a challenge to do in a remote capacity. And the regulators in that discussion, they said they had approved remotely a terminally sterilised product through doing an assessment, but their view was that an aseptic process would be a step too far to try and do. So that's one thing. And I think as well, back to the FDA guidance earlier as well, I think there's clear things there that it talks about if there's been past data integrity issues, then any type of remote assessment going forward wouldn't be able to do so. That would need on site. Looking at the next question, any tips in particular for a new establishment that will undergo a first GDP inspection to secure a wholesale dealing authorization? I think the first thing is to ensure that you've got a good clearly a good quality system. I'm not sure where you're based. As a good piece of advice, the MHRA, the Irish authority, have almost published an entire quality system for wholesale dealing. They took the view that trying to gain a common standard, well, a common level of quality system at wholesalers was beneficial. So I would suggest looking at the MHRA's website there, I think initially, to try and see if there's anything there at all that would help. If not, there's certainly when I was at MHRA, we created a blog, and that's got a large number of posts from the GDP team and the inspectors that talk about the inspection process and what's expected of you as an organisation. So that's another good place to look. What I'll do is these questions, we will get your details afterwards, and I'll be able to contact you as well. So, and the next question was about the FDA. Have they conducted remote inspections before the issuance of that guidance? And is there any way to know how many remote inspections they've conducted? Well, certainly, yes, they have. In terms of knowing how many they've conducted, I haven't seen anything that does give that. Whether something like FDA Zilla does have that information, I wouldn't be entirely sure. But I mean, absolutely take it though that they have been conducting inspections in a remote capacity to drive things forward. And as I say, relying a lot more on the other systems that are available to them, you know, through wider discussions with regulatory partners to try and help drive those things forward. Well, thank you for your listening today and joining. That's almost leading us right up to the 20 minutes. So so again, if I or Parexel can be any help of you going forward, please do get in touch and enjoy the rest of your day. And if any other questions come in, I will follow those up with you directly. So thank you for your attention, and goodbye. Thank you.